Hello, my people. Welcome after a very long weekend. Everyone has been busy every weekend, doing ups and downs. Weekends is a good time for relative meetings, seeing people that you have not seen. But it's a good day that today we are here. We thank God for everything. At least we continue with our talks and we know what we can do. Last week, recap of last week, we studied uh, we studied so many things and we learned so many things again. So we remember that we studied something called hypertension, how to treat hypertension. We managed hypertension, and at least now people know what to do. Yes, Doreen Small, thanks being on the platform. Thanks a lot coming to the platform. Although today I've been late, things have been so many. We thank God for everything. We thank God for everything. Today, the topic of today is arthritis. And I know so many people will understand and get to know what is arthritis because when people get some pains on the limbs, the legs at times, you find some people saying that I think I have arthritis. You see, it's good to say that, but right now we really need to understand what is arthritis. You see, and how many types of arthritis do we have, and how does arthritis again affect our body and mental health again? Because there are some things that we we check on when it comes to arthritis. So the word arthritis, what does it mean? When you are asked what is arthritis, what do you say? People say, I think I have arthritis. My legs are so painful. I'll go to the doctor and see uh, what I can do. Mm. We will see there are so many types of arthritis and how to manage them again. So when it comes to these conditions that we talk about, autoimmune, so there is a word called autoimmune. When I'm talking about autoimmune, these are diseases that your body, yes, Dorothy, yes, peleka polepole, wewe peleka polepole, minamiti. Yeah. Sawa sawa. Okay, now Dorothy, come. Kuja na yeye na usimame hapa. Abraham. Now we continue a bit about arthritis. Sorry for the disturbance. Now we were talking about arthritis when I was explaining about autoimmune diseases. Autoimmune diseases is a disease that your body fights against itself. Some cells of the body fight against themselves. So when we are talking about arthritis, what are we talking about? It's not a single disease, but a general term for conditions that cause inflammation and pain in one or more joints. You get it? This is a general term. Arthritis is a big term, a general term that says there is inflammation and pain. So do you understand what the word inflammation is? What is inflammation? Hmm? What is inflammation? Because these are words that people talk about it daily, but you see, when you talk about inflammation, some people don't understand really what inflammation is. Yeah, inflammation is okay. Sorry guys. Inflammation. Just a minute. A minute. Yes, sorry guys, I'm back. It's been a very great day, and Kali MTN. Can a person under 30 get arthritis? Yes, Kali, we are going to see how people under 30 can get arthritis. And you see, we have just started and we are saying arthritis is a term. Inflammation that gets you, you getting this inflammation and pain. It's a general term. Hmm? Of conditions that describe inflammation and pain in one or more joints. You get it? So being a general term means what? It means there are several types of arthritis. And the main symptoms of these types of arthritis, the main symptoms can be joint pain, swelling, stiffness, and reduced movement. You don't have movement. But let's see here. There is one term that I want us really to discuss. This one term is the one term that we really need to discuss in inflammation is in arthritis is inflammation. You always say I'm undergoing inflammation. People tend to understand they think they understand the term inflammation, but let's see what inflammation is. Inflammation is the body protective response to injury. Your body gets injured and then it responds. You get it responds to injury or infection or irritation. Like your body builds an emergency system calling it reinforcement so that you cannot get more damage. The main purpose is to eliminate the cause of injury, remove damaged cells, and start healing. You see, now that is what we call inflammation. Inflammation is protective response to injury, infection, or irritation. Your body creates a protective response to in injury, infection, or irritation. Like it develops an emergency system, hmm, calling it reinforcement. You get it? The main purpose is to eliminate what in this term called inflammation, eliminate the cause of pain, remove damaged cells, and start healing. You get it? And there is types of inflammation. I'm talking about inflammation because it's a term that everyone needs to understand, hmm, that everyone needs to understand to get to know what arthritis is. You see, acute inflammation duration is short term, like minutes. Your body creates an emergency system, you get a swelling, yeah, it eliminates the dead cells, and then you start healing. Yeah, cause as like trauma, infections, burn, allergic reaction. And then there is chronic inflammation. Chronic inflammation is long term, weeks to years. It can take years. But what can you look at and know that I have inflammation? One, redness. Your skin turns red. Two, it builds up some heat because when some things are working out and building up, heat comes in. You get it? And then don't forget, if there is a place that is injured, you get a swelling. You get it? And then you cannot just get a painless swelling. Pain must be there when inflammation is there. And then loss of function, movement limited. Sometimes you cannot move the limb because it is affected and it has a swelling and it is red and you have pain. So the signs of inflammatory response is redness, heat, swelling, pain, and loss of function. You get it? Now, let's get to our topic, which is arthritis. Arthritis is our topic of today, which is very important topic, and we really need to talk about it because these conditions that are chronic conditions at times, they don't have treatment generally, they are managed. And you see, when a person mentally learns that I cannot be treated, I can just be managed, it becomes a mental health issue. So, after learning about arthritis and all forms of arthritis, what will we do? Management. Very important, management. So, today we are learning what is arthritis. And the first thing we have been told is arthritis is a general term. It's a general term to mean inflammation and pain in one or more joints. So there are several types of arthritis. And through arthritis, we have learned another term called inflammation. Hmm? Inflammation that comes in with redness, heat, swelling, pain, and loss of function. So let's go back to our arthritis. Hmm? Can be due to wear and tear. You see, there are several things here we need to learn. Arthritis is not just one arthritis. So someone called Carly MTN has asked, Carly MTN has asked me, can a person under 30 get arthritis? I've said it's yes. You can get arthritis considering the type of arthritis that you can get, because you cannot just get all types of arthritis. There are several types of arthritis, and let's look here. Let's go to types of arthritis, and we see types of arthritis. What are the types of arthritis that are we know? You see, because we have been told it's a general term. Types of arthritis. What types of arthritis do you know? Because the common one, when you go to a hospital and then you're told, let's do rheumatic factor, they say you have rheumatic arthritis. Hmm? The types of arthritis that are there, I will list them. Osteoarthritis, that is one. Degeneration of joint cartilage, often with age or overuse. You get it? Overuse. You have problems with your joints and bones. We call it osteo. Anytime you hear something called osteo, related to a bone. Anytime you hear something called osteo, related to a bone. Anytime you hear something rheumatoid arthritis. Aristo, Pat checking in dog. Welcome, Aristo. If you have any question, please put it on the platform. And if you need a private consultation, I'll put my email. Most of you guys have my email address. You can send it there. We discuss. Now, when you hear about rheumatoid arthritis, what does this show you? Genetics, autoimmune, Hmm? Autoimmune disease attacking the joint. And autoimmune, I want to explain these terms very clearly and very smoothly, so that no one loses any side, anything. You see, it's very important to understand these things, so how to manage. If you don't understand something, it will be so hard to understand. So, what is autoimmune? Because we have seen somewhere here in rheumatoid arthritis, it's an autoimmune disease. So I will not tell you autoimmune and you don't know what is autoimmune means. You get it? This is, and I explained further, and I said before, I said autoimmune condition is when your body immune system, your body, you can be sick without taking any medication, you get better because your body has fought the pathogens. When I'm saying pathogens, the bacteria or the virus or the fungus, they have taken the fungus. There are some cells called macrophages, natural killer cells. They have dealt with it and they have removed in the body, and you are okay. You get it? But now, here, we are saying what is autoimmune condition. It's when your body, someone has Aristopat, okay. Say hi to everyone. Please like the video. Don't just leave. Like the video. If you have a question, ask. At least we know we are doing good. Now, what condition is when your body immune system, which is supposed to protect you from infections. You get it? Which your body is supposed to protect you from infections. It's supposed to fight the infections and harmful substances mistakenly. Eh? starts to fight your own cells. This is where we call autoimmune. You get it? Imagine your body, which is helping you to fight pathogens that have said bacteria and all sorts, is trying to fight your own cells, tissues, and organs. Hmm? Just think about it. Think about it. So when we come and talk about rheumatoid arthritis, and I say autoimmune disease attacking joints and lining, you understand what is it? It is a condition that your body, some of the cells of your body are attacking some of the cells. Very interesting, yes? Very interesting, very interesting. What foods are good to build our autoimmune system? Aristopath, that is very important question. Very important, and I'll answer it. Just stay on the platform. You will see. You will see. There are several foods that build up your immunity like vitamins, but I'll tell you how to take them. Now, we are on types of arthritis. You see, we started by defining arthritis, and then we saw it's a general term that explains inflammation. Then we said, what is inflammation? It's a immunity process helping your body, but comes with redness, pain, and then some other thing that is called swelling. Yes, you get it, and heat. And then after that, I said we are going to see types of arthritis, and we said osteoarthritis, dealing with the bones, cartilages, and then rheumatoid arthritis. Now, we cannot learn if we don't draw, because we need to understand what is what is a bone and what is a cartilage. You see, now I will draw here a bone, a bone. This is a leg of someone. Maybe it's a leg of Benjamin the wise guy. Benjamin the wise guy. And then there is this is the knee of Benjamin the wise guy. The knee of Benjamin. I'm drawing a knee. Now, this one is your leg. This is called the femur on your thigh, the bone on your thigh. Then we have tibia and fibula. Tibia and fibula, the two bones down. So there is a cartilage that lines here, here, here. A cartilage. A cartilage is what helps you to move your legs and move here. It lines here. So when you talk about osteoarthritis, it's degeneration of the cartilage. The red thing that I've drawn there, here is the degeneration of this cartilage. It destroys osteo. It destroys. Rheumatoid, we have said it is autoimmune, where the cells of your body fight your body. Don't forget, we have other types of arthritis like gout arthritis. When your uric acid elevates, goes up. So when your uric acid elevates and goes up, what do you think will happen? Crystals build up. We will see how those crystals build up. And then we have psoriatic arthritis linked to psoriasis skin disease. Psoriatic. Imagine you have skin issues, skin problems. You always have skin problems, itchy, scratching yourself every time and feeling uncomfortable, and it's arthritis, and you've never known. At least today you have known. Hmm? You've been having a problem that is arthritis. We will see what, because not all types of skin issues are arthritis. And then we have infectious septic arthritis due to bacteria, viral or fungus. You see, an infection of bacteria or fungus or something else can cause you to have arthritis. So today, what types of arthritis have we reached? We have gone to osteoarthritis, rheumatoid arthritis, gout arthritis, psoriatic arthritis, and infectious septic arthritis. Every time you hear me talking about sepsis, know that I'm talking about infection, pathogens, bacteria, fungus. Another one is virus. You see, septic arthritis. Bring your questions. I have some questions that I will answer, like what foods are good to build autoimmune system. You see, and can a person under 30 get arthritis? Yes, those are the questions that I'm going to answer now. Now, what do we start with? What is the common type of arthritis? Now that we know arthritis is not just one term. It's not just one term that is arthritis. I have arthritis. No, you should categorize yourself with a term that is under arthritis. Now, let's go to rheumatoid arthritis. Rheumatoid. This is what we call rheumatoid factor arthritis. When you go to the hospital and then you are asked, you are asked, let's take your blood. Let's take your blood. We are going to do something called rheumatoid factor. What they are saying is they want to confirm if your bloodline you have that factor of arthritis. Roger Killer in the house. Hello, Roger Killer. Today we are dealing with the arthritis. Roger Killer, years ago I sprained my finger. To this day I have pain. Can this be arthritis? Yes. Yes or no? Let's see if it is arthritis, Roger Killer. Now, you just watch. We have started, we have said we have several types of arthritis, and now this is the first one we are dealing with, rheumatoid arthritis. Roger Killer has asked a question. Roger Killer has asked a question. Let's see if it is arthritis, and then we do what? We help Roger Killer. We help the other one was called sprained. No, that one is aristropathy. Sorry. Aristropathy said years ago I sprained my leg, my finger. To this day I have pain. Can this be arthritis? Aristopathy, it can be arthritis depending if your rheumatoid factor is positive. That's why I've started with rheumatoid arthritis. Kish, hello. Kish, welcome. You're talking about arthritis and you have started with the first one. There are some terms that we have talked about. The question is by Aristo. Sorry. Yes, sorry. I've corrected that. I've corrected. Yes, and I've answered Kali MTN. Kali, can a person under 30 get arthritis? I've said yes, you can. Just listen to what I'm going to say and you'll answer your question so correctly. But don't be afraid to ask questions. Please just come out with your questions because they may help someone or they may challenge me to help you more. Okay, we continue. The topic right now that I'm going on is rheumatoid arthritis. All right, let's break down on rheumatoid arthritis and see is what we can do. Yes, rheumatoid arthritis is a chronic systemic autoimmune disease. Systemic autoimmune disease. We have defined what autoimmune disease is. Autoimmune it means the body cells that are supposed to help your immunity are fighting other body cells. We have very many cells like cells of the skin, subcutaneous cells, we have tissue cells, we have several cells. You understand? You get that? Very important. We have several cells in your bodies that do different things, but you will find one type of cell is fighting against the other. That is called autoimmune. So, rheumatoid arthritis is a chronic system autoimmune disease that primarily attacks synovial joints. Synovial joints. And I drew a very, please at least like the video as we go on. Give me the morale to show that I'm doing a good job. But if I'm not doing a good job, correct me somewhere, or rather maybe I'm moving so fast. Yes. If you don't understand, ask the question. Look at my joint here. This is my joint, and this is the knee. So synovial joint, there is a fluid here between the joint which is called synovial fluid. So rheumatoid arthritis, as we speak, rheumatoid arthritis. What is rheumatoid arthritis? is a chronic systemic autoimmune disease that primarily attacks the synovial joints on your knee, where the synovial fluid is. The joint lined with synovial membrane, a membrane that is here in the joint, here in the joint, a membrane. So when it is eaten, hmm, it is eaten. You see, how we are explaining is a chronic, something that goes on chronically, systemic autoimmune disease. Cells of your body are fighting against some cells. So it means, because they are saying, it says synovial joints is primarily attacked. Here it is at the synovial joint. Yes, Kali MTN. We have started with, listen to this Kali MTN. We have started with rheumatoid arthritis. And your question is, do this type of arthritis affect the knees? Yes, Kali MTN, they affect the knees. Why? Because rheumatoid arthritis the main place that they attack is synovial joint, places that we have synovial fluid. And you see, this one is your knee, and we have synovial fluid here. So every place that you have synovial fluid, it will attack. It will attack. And you have just answered yes, because there is where the knee is, synovial fluid. Daniel Stamegna, God bless you and your channel, and thanks you for speaking on the topics you do. Thank you so much, Daniel. I'm so delighted, and God bless you too, coming and helping us to go on. Like the video, let's share, because while you are sharing this video, imagine if you share this video and someone gets the information, you can save a life. Just by getting information, someone can go to hospital and know, maybe this is not a rumor, I can be helped. Please share, like, just like, share, let people get information. Yes, thank you, Daniel. I'm so blighted. Old folks told me that arthritis cannot be cured. Is it true? That is a very important question. Is it true? My answer to that will be yes, it is true, and no, it is not true, because we have seen there are several types of arthritis and being brought by several. So there are some arthritis that can be cured, but there are some that can be managed and not cured. You relieve the symptoms and you help the person not to go on to deteriorate, to at least to live a comfortable life. Aristo underscore part. That is what I can say. You get it? Halfway. We have just started learning. Let's listen and go slowly. Now, we have said they affect the synovial. It leads to inflammation. So rheumatoid arthritis leads to inflammation by some cells fighting against other cells and causing inflammation. We have said inflammation comes out with this. Inflammation is your body helping itself to recover. So when you are injured, it brings a swelling, it brings redness, pain. You get it at the injury. Those are the signs of inflammation. Thickening of the synovial at the limbs, at the knees, where the synovial fluid is. Here at the elbows, what do you find? You find your knee is inflamed, it is swollen, because it is the side of inflammation. It is swollen, and progressively destruction of cartilages. You see, at your knee, we have cartilages that are holding. They are like a bladder, so that when you are moving, and they are pushing your leg so that you can move freely and well. You get it? And progressive destruction of the bone. So when you move, this is, I love drawing my people. I love drawing. When I was in school, I used to love anatomy because I knew I would draw and draw. So let me draw here. This is your bone, the femur, femur. Femur is the bone of your thigh. I will show you what I'm drawing just right now. Femur is the bone of your thigh. So primarily, when these bones are like this is how they are supposed to look like when you are normal. You get it? This is There is a space here. Let me draw with red that has a fluid that acts like a cushion. The red space that has a fluid that acts like a cushion. It lies on it on top so that this bone cannot corrode the other bone down. You know, bones are hard things, so when they corrode, you will feel pain. But we have seen in rheumatoid arthritis, there is something that is eating the cartilage down here and here. So the synovial fluid that is acting like a cushion does what? Leaks off. And now the upper bone, which is the femur bone, the upper bone, the thigh bone, the bone that you have in your thighs, reaches and it starts to eat the other one. So there is friction on your legs, on your knees. Here, there is friction. You see the difference? This is this is very close, and the other one is a cushion. It's around here, a cushion. So this one, it will be eaten up because of friction. That's why people with rheumatoid arthritis, and we have seen primarily they affect the synovial joint, it swells. You get it? It swells. So what happens here? It leads to inflammation, thickening of the synovial, and progressive destruction of the cartilages and the bone. Cause, exact cause is unknown. So there are some things. Let's say you go to a hospital and you want to know the cause of rheumatoid arthritis. Why am I having rheumatoid arthritis, guys? Doctors, you've learned, you've gone to school, you've got degrees, and you know everything. Well, no, God knows everything. We are just learned, but we don't know everything because our research has not led us to the right thing. The exact cause is unknown of rheumatoid arthritis, but we know there are some cells that eat other cells, fight other cells so that they affect the joints. And it is said immune system mistakenly components of the joint as foreign. You know, soldiers, when soldiers go for a battle and they meet a stranger, they fight the stranger. So there are some cells of your body when they are surrounding, going through the body, looking for any pathogen or something that be foreign. If they find this thing it's not okay, they fight that thing. So cells of your body mistakenly goes to the joints and they think these cartilages are strangers. They start killing them. That is rheumatoid arthritis. You get it? Inflammatory attack. They start fighting it and then you form inflammation. So that thing, that mistakenly fighting cells fighting their own is called autoimmune. You see? Now, risk factors, the people that are at risk to get this. Who are the people that are at risk? And there are some questions that have come out here, and I want them to answer themselves here. Who can be at risk of getting this type of arthritis, which is called rheumatoid arthritis? Genetics. There are some people that have a factor called HLA, DR4, and DR1. Those are factors that we go to the lab and find out about the genetics. I know everyone knows about DNA. You get to know the specific DNA of a person. Now, in genetics, these are like DNAs. We go and do to find if the person has this factor. And mostly, it's so unfortunate, mostly women are mostly affected. So risk factors for arthritis, one is genetics, two sex, female sex affected. Don't forget age, because when age you go older and older, when your age advances, is when now you get more problems autoimmune. You get it? Environmental, like smoking. Imagine smoking has come in again in arthritis, infections, and hormonal factors. Hormonal factors can make you get autoimmune infections like rheumatoid arthritis. Now, I've tried to explain about rheumatoid arthritis. Guys, ask me questions. Yeah? Let's share. Do you have an experience of a person who was undergoing this? Don't be alone. Let's ask questions. Let's share experiences. Let's share. Like someone told me here that that was a question by Aristopat. Years ago, I sprained my finger. To this day, I have pain. Can this be arthritis? Aristopat, what do you think? This is my advice. Go through your genetic line. Ask your dad, ask your parents, ask your grandmother. Have you ever had someone in your family have has suffered arthritis? If it is yes, your close relative, your father or your grandfather, mother, you should know you have genetic factor of your arthritis in your family. So what is the next step? You go to a hospital, they'll do a test called rheumatoid factor to confirm that you are arthritis positive genetically, so that you can start, because when you are injured, that is where problems come in. Now, immune system, antigen presenting cells present to antigen T. We have talked about all these cells when they fight. There are cells like T cells, inflammatory cytokines. Those are very complex medical issues. Synovial membrane hypoplasia. I'll just go pass because I've tried to explain. Immune system activation. The cells now discovers that these cells can be foreign, and they are your body cells. And then T cells activation triggers B cells activation. These are cells. These are cells now that triggers the other cells. Autoimmune antibodies like rheumatoid factor and anti-CCP antibody. And then there is inflammatory cytokines. Those are cells that now fight the effect of the other cells killing the others. Synovial membrane hypoplasia, you swell and you start feeling pain. Hmm? And when you swell, some cells are dying. So what are you forming? Some granulation tissues, like when you are cut and then there is something that has formed. So if you get an injury and it gets treated, will you, if you get an injury and it gets treated, will rheumatoid arthritis go away? No, it cannot go away. Kali MTN. You see, when you are arthritis positive on rheumatoid arthritis, it means your genetic line is passing that gene. The gene that I've said, it is called in genetics, maybe some people are born with HLA-DR4 and HLA-DR1. And some families, some people are not born with this gene. So you who has an injury and it has healed, and you are still having these genes will not go away. You can pass them to you will have a child with a woman, and that child maybe will carry these genes because your sperms and her egg have carried your genes plus her genes. So you might pass the gene to her, to the baby that is for coming. You get it? So you will heal, but you will still remain with the arthritis genetically. No, we go. So we were at formation of patterns. Yes, Kali MTN. Yes, don't be afraid. You see, it's like you are living with something, but it is not disturbing you. But when it disturbs you, you manage it and you are okay. So we are continuing with this. Partners invest cartilage bone, and then we have talked about erosion of the bone. Very important. When your bones are always having inflammation and you are feeling pain and they are swelling. Now, There are some key features that you should know in rheumatoid arthritis. And you know, this is it's only one, rheumatoid arthritis. We have not gone to others like osteoarthritis. Now let's see key clinical features in arthritis. The first one is inflammation, and it will cause pain, swelling, and stiffness. Sometimes stiffness because there is no synovial fluid. The cushion has gone. It has been fought by cytokines and other cells, and it has drained. So you are having a stiff legs, morning stiffness for more than 1 hour before you wake up in bed. These are the signs and symptoms of this. Commonly affects the metacarpophalangeal joints. Metacarpophalangeal joints. Yes. What do you know about metacarpophalangeal joints? These are joints that are of. Sometimes I talk faster. If I'm faster, please tell me I'm faster. Eh? Phalanges, stiffness of your this. No, these are joints of your hands. Hmm? Joints of your hands, the bones of your the joints, so not the feet, metacarpophalanges, phalangeal joints of your hand, they really are affect them. Proximal interphalangeal joints, yes, my knee gets stiff. Yes, during small. Yes, but don't worry about it because I'm gonna show you what to be doing and you will be okay. We are going to learn how to help ourselves. This is just rheumatoid arthritis. We have not started working on the others like gout arthritis. So there is metacarpophalangeal joints are these joints, these ones, these joints, they get stiff. And then there is proximal metacarpophalangeal joints. Whenever you hear about proximal, something that is uh, near. Proximal metacarpophalangeal joints. Those are things that are near. Proximal, near, here. You see here, distal proximal here. You see, distal is away, proximal is near, near the here joint. Now we continue. The wrist is affected. The wrist, the knee, ankles, and elbows. You get it? The knee, ankles, and elbows. So don't worry about this. These are managed issues, and I'm going to show people how to manage them to live a good life. Yes. That's why we are learning. You cannot learn and then you don't give people solutions. Okay. And then it affects symmetry. Symmetrical. If it is this side, this side. If it is this joint, you find this joint. Okay. Extra articular features because of its rheumatoid nodules. You will find people having rheumatoid nodules. Have you ever gone around and see someone's joint has come out like a ball and it is very hard? Eh? It is firm lumps under the skin. You try to push, you feel it is very hard. Those are called rheumatoid nodules. You get it? Those are called rheumatoid nodules. Vasculitis, blood vessel inflammation. Imagine your veins and your arteries swelling. Your veins and your arteries swelling. You get it? Those are called vasculations. Vasculations. And then we have lung involvement. This is where it becomes a complication. Pleuritis, intestinal lung disease. You see, it gets up to your lungs. Even sometimes breathing becomes a problem. This is rheumatoid arthritis. Autoimmune. Hmm? Your cells are fighting against each other. Eye inflammation around the eyes. Kali, there was a time my fingers swelled and those joints you are pointing and they were stiff. The pain disappeared, but sometimes it come back. Also the shoulder and my elbow sometimes. Yes. Kali MTN, I can advise you to go and do rheumatoid factor. Visit a hospital where you are. I really don't know where you are in Kenya or where or you are which one you need to do rheumatoid factor to confirm if you have that gene of rheumatoid arthritis. And then you see, we are continuing. If you have all these signs, so it means, or you are in Nairobi, walk in any hospital in Nairobi, Metropolitan, Aga Khan, and tell them these signs. They'll do rheumatoid factor and they'll tell you. But today, I want you to learn on how to manage if it is positive and if it is negative. Now, anemia of chronic disease. You have a disease that is causing you to bleed, rheumatoid arthritis that is advanced, deformities. Sorry, guy, it has been a very busy day, and we are continuing to learn. Let's learn, but please, as we learn, share these videos to your friends. I want to people to get information. Now, deformities: your ulnar deviation of the finger, swank neck deformity, bottom-neck deformity, flexion people. These things, I'll come with them one day, and you'll see how the ulnar deformity, this ulnar deformity, your hands can be like this. You see, hmm? Or like this, or turned like this, and you cannot move them. You've met someone that this finger has gone like this. Swan neck deformity, hyperflexion of PIP, flexion of PIP. Now, investigations of rheumatoid arthritis, my people. Investigations. Hmm? Blood tests to be done. Rheumatoid factor, that is what I really want Kali MTN to do. Rheumatoid factor, it can be positive in 70 and 80% of patients. But there is another test that you really need to do, which is called anti-CCB antibodies, which is more specific for rheumatic arthritis. Rheumatoid factor is not so specific, but anti-CCB will help you know if really you have rheumatoid arthritis. And then we have ESR and CRP. You see, erythrocyte sedimentation rate and CRP, that one, those are things that are showing you are having an something of inflammation, or which type of inflammation are you undergoing. You see, those are cells that helps you to know which type of inflammation you are undergoing. Imaging studies, you do an x-ray, to see how your bones are, and then we go to management. Now, this is the real deal, where how to manage rheumatoid arthritis. You have gone to a hospital, doctor, I'm feeling pain. Ma'am, when I wake up, I take 10 minutes, my fingers are stiff. At times, getting to bed is a problem. I have to wait a bit. A doctor tells you, yes, my friend, you'll be okay. I just need your blood to be taken to the laboratory, and then we do this test. And then, if it comes out positive, what will happen? I'll help you live better. So, how can I manage you? The blood has gone to the laboratory, it has come back, it is positive on gene HLA-DR4 or CRP. It shows that now you are rheumatic factor positive. Let's do this. Rheumatic arthritis has no cure. Not that, because now this is associated with genes. You cannot take genes away from your body. That's why it has no cure. It is manageable. But you can live without knowing you have these genes. You can live without knowing even you have rheumatic arthritis. But one day when you are old and then you start feeling pain, you go to a doctor and they do these tests, they find out you have been having this thing. So what do we say, or how can we help people? Hmm? If you are here and sometimes you manage this, help me. Let's talk. It has no cure, but early aggressive treatment can slow progression, because this is a disease that if it is not taken care of, it progresses step by step. So lifestyle support is the first thing. Rest during flares, physiotherapy, joint protection techniques, yes, and stop smoking, because we saw smoking has something called free radicals, cancerous, that cause autoimmune infections. Now, you're smoking, and it's going to your lungs, and it is causing free radicals that cause autoimmune. And then you find yourself having arthritis. You just stop smoking. Yes, let's stop smoking. Hmm. But you see, if you find yourself you are genetically positive on arthritis, what next? What can you do? You do some minimal physiotherapies because more physio can make you have more pain. That is the bad thing. People like to go to the gym. I think that is the bad part. Let people go and work out and feel good. And then we have NSAID, mm, drugs now. NSAIDs are like Brufen, all those diclofenac symptoms relief only. They relieve the pain. When you take the painkillers, they relieve. And then, sorry about that, guys. It's been a very long day, and I should continue and do everything as per needed. Now, we have glucocorticoids. Glucocorticoids are drugs that you go to the pharmacy and you tell them I need this drug because my arthritis. You know, some people you should be praying to God. You can't go to a pharmacy or a doctor's office and then you say my arthritis is bad. Don't possess a disease. Kick that disease in Jesus' name. Say, I'm not sick and I will heal. Because some things heal mysteriously. Hmm? So, but if they are not healing and you are feeling pain, you get some drugs like glucocorticoids. These are drugs that will are anti-inflammatory. They stop the inflammation process so that you cannot have swelling and the process you have seen of inflammation, like hydrocortisone, hmm, natural steroids, dexamethasone, prednisone. There is a difference between prednisolone and prednisone. So when you go to the shop and then you want to a drug for inflammation to stop the pain, you don't just take you don't just oh yes, Doreen Small is taking calcium, magnesium, and zinc plus vitamin D3. Hmm? You see, these are when you take these supplements, they are called supplements. During 3, they are very helpful because vitamin D3 is a cofactor. Magnesium and calcium, they are building up your bone. And people who have arthritis, and let me ask Doreen 3, if you have been open also, have you ever done the rheumatic factor? How did you start taking the medication? Did you do any tests? I really want to know if you did any tests. Mm. So these drugs, they help you carry on and at least your bones not to be eroded so much. You may not be having positive, positive genetic sign of rheumatoid arthritis, but you are having other arthritis. You know, this is the first part of arthritis that you have started with. No, I didn't. Yes, Doreen Small, at least it's better you do that test or recheck your family line if someone had rheumatic arthritis and you see. Because these drugs that you're taking, mostly they are used in osteoarthritis. Osteoarthritis is another form of arthritis that we are going to look at. Now, we continue to look at, wait a minute, I set these things. These eggs are killing my eyes, yes, like that. Now, we continue on glucocorticoids. You have seen they are anti-inflammatories like prednisolone. Prednisolone, everyone knows prednisolone. If you don't know, today at least know that they are anti-inflammatories. And then we have this called DMARDs, DMARDs, disease-modifying anti-rheumatic drugs, disease-modifying like methotrexate, first line. Hmm? They help you not to deteriorate or the autoimmune process to stop. The cells that are fighting other cells in your synovial fluid to stop fighting them. Hmm? And then we have biological agents like if an explosive to diamond, tissue necrotic factor alpha inhibitor. Those are drugs that stop the tissue inhibitor chronic factor to eat your body because there is something called TNF that can eat your tissue when it is not fine so that it can be eliminated from your body. Hmm? And the last one here is surgery, joint replacement for damage, where your joint cannot be replaced anymore. So they go and remove it. They go and remove the joint. You see, very nice presentation, very nice talk on rheumatic arthritis. And we have said primarily they attack the synovial joint. Any place that you have synovial fluids along the joints of the long bone, you know that. Hmm? And it's autoimmune. Autoimmune. My mother used to suffer from arthritis at the age of 97. She tried so hard for her knees, we hardly could touch. Doreen, if you could take prednisone for her, hope she was not diabetic, the pain could reduce. Or if your grandmother could get an injection of dexamethasone injection, that pain could reduce because it's so effective. It is so effective because it stops the inflammatory process. Yes, anyone with a question on rheumatic arthritis, I introduce another one. I think that was a good presentation and everyone has understood and we are going on well. The questions are coming clear that out there people are suffering from this disease and we need to share this video and we need to like Benjamin the wise guy for at least telling us what we need to do. We love Benjamin the wise guy. Yes, we love him. Yes. Kali MTN, Kali MTN. My regards to you is you go to a hospital around Nairobi, just ask them to do a test called rheumatic factor. Confirm for yourself if you have it in your genetic line. Just know now you are positive on it. If it will come positive, start management. But if it will come negative, what do? You live life happy and jump around and say, God has come forth for me. Let me live life. Now, that was the first one. And then we have several that are left, like gout arthritis, psoriatic arthritis, osteoarthritis. Now that we have dealt with autoimmune one, let's deal with infectious arthritis, septic. When you get an infection and it turns out to be arthritis. And then the other ones, we will continue with them tomorrow. Hmm? With them tomorrow. Okay. What is the time? Six. Okay, it's 6 here in the evening, 6:15, and we see we get to see everyone is the platform. Okay, it's 6:15 here. We continue. We have talked about rheumatoid arthritis. We have seen it is genetic. You cannot do anything. You can manage and reduce the progression to disturb your body and deteriorate by using some drugs and lifestyle changes. But now we go to the other one, which is infectious arthritis. You see, there are several types of arthritis. So when we talk about infectious arthritis, what rings in your mind? Infection, infectious arthritis, infection. Infectious arthritis is a joint infection caused by invasion of the synovial space by microorganisms, hmm, leading to rapid destruction if untreated. We have talked about rheumatoid arthritis, whereby the synovial joints here, these ones, they are autoimmune, they are destroyed by your own cells. But now we see it's a joint infection caused by invasion of the synovial space by microorganisms. So microorganisms like bacteria, they come here on your joints, and what do? They are living things. They destroy by eating the tissue and the synovial fluid. I don't know if they drink the fluid. Hey, they must be drinking the fluid. But no, bacteria eat and destroy and they form pus. So the bacteria are Streptococcus aureus, Streptococcus species, gram-negative bacillus like Neisseria gonorrhea. Hey, yeah, imagine Neisseria gonorrhea in young adults. E. coli, Pseudomonas in immunocompromised. So one day, if you get gonorrhea, if a person you don't take care of yourself well, you knick-knack out there, and then you get gonorrhea, you see what can happen. You will get arthritis if it goes to your synovium. Now, there is rubella, mumps, hepatitis B, and HIV if it is a virus. Even a virus can destroy your synovial joints. You get it? And there is something else that we know can bring a problem. Hmm? You see, there are some things that can bring a problem. We know of bacteria, and then we know of something that is called a fungus and and a virus. Hmm? A virus cannot be treated, it can be suppressed. You can suppress a virus, but you cannot treat. Viruses are not killed, they are suppressed. And then we have fungus. Fungus are treated. Now, when we talk about these issues of now, this is where the question of MTN comes in. Can we treat? Yes, we can now because here some people very na kitu tu. Yes, sorry, guys. Multitasking, man. Multitasking. A, B, C, D, E, F, G, H. Me here, me there, me everywhere. Me, doctor, everywhere. Now, we continue. We have said in arthritis, we have causative organisms. This is infectious arthritis. And the causative organisms are bacteria, 2, a virus, 3, a fungus. You see that comes in very clear. Mm? And then risk factors. Those people can be at risk of getting infectious arthritis. Pre-existing the disease. Maybe you have rheumatoid arthritis, gout, or osteoarthritis. We will talk about osteoarthritis and gout and rheumatoid arthritis. We have just talked about it. And sometimes prosthetic joints. Prosthet- Prosthetic joints are assisted joints by something that is not your body, a foreign body like metal. Those that you put in your body to assist you to walk and help you to do things, prosthetic bodies. And then we have immunosuppression. When I'm talking about immunosuppression, you know diseases that can suppress your immunity, diseases that can make your body not to work normal, to be affected anytime with a bacteria, fungus, or a virus. We are at risk factors of those that are at risk factors of getting this infectious arthritis. If you have pre-existing disease, prosthetic joints, those that have been helped an artificial thing that is not your body, immunosuppression like HIV, diabetes, and corticosteroids. Hmm? During small, cod liver oil is very good for joint pain as well. Hey, Kish Kish. Hey, tell me more here, Kish Kish. It is good in cod liver oil is good. I want Kish Kish to help us there because he's saying But you see, Kish Kish, let's talk scientifically because we talk with proof. And that's what I want us to help each other, mm, to understand. Mm. I want Kish Kish to understand. Kish Kish, I want you to understand when you, if you took, did you take cod liver oil yourself? I want to explain to you why it is helpful. It's true, it helps. Yes, and now I want you to understand why it helps. Kish Kish, listen to this keenly. You are very right, and you have bring a very good topic. It contains vitamins, and vitamins are called cofactors. They make your muscles strong and some other factors strong. Listen, it is rich in omega 3 fatty acid. You know, omega 3 fatty acid, what it does, have an inflammatory effect, anti-inflammatory effect. It stops the inflammation of the bones so that you cannot feel the effect of arthritis, which can reduce joint swelling, stiffness, and pain. That is the work of omega 3 that is in that cod liver oil. But remember, it has other substances like vitamin D, support bone health. Eh? Help vitamin D helps calcium absorption, reducing risk of your bone being weak. Yes, you hear? Kish 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 kish. You are a good one. You are an example. My Tennessee Sky, come, big up always. You are in the platform. We are dealing with arthritis. We started with defining the terms, and now we are going on. We have done rheumatic arthritis. Now we are on the other arthritis, which is called infectious one. Hmm? You get it? Now we continue very cleanly and clearly about this topic. I was explaining to Kish Kish about how it is helping. You know, Kish Kish have got the results of this cod liver oil, but understanding the part of medical part is what I want Kish Kish to know so that he can continue taking and help other people. So vitamin D in the cod liver oil. No, this what I'm explaining right now is not osteoarthritis. It is infectious arthritis. Infectious arthritis is caused by a bacteria, a fungus, or a virus. I'm just explaining what is in cod liver oil and why it is helping you, Kish Kish. Now, you see, it has vitamin D. Vitamin D helps in calcium absorption. So, when you absorb calcium, when you eat something with calcium, vitamin D helps in absorption so that it goes to make your bones, reducing the risk of weakening of the joints. Hmm? You see, things like that. But don't forget, it contains vitamin A. Go to the cod liver oil and check at the ingredients. You'll see vitamin A. What do we know about vitamin A? Important for immune regulation. So, too much vitamin A can be harmful. So, dosage matters. And that's why you are told at times take 5 ml or 2 ml. So, we have seen one, omega 3 in cod liver oil helps in inflammation to reduce the pain, swelling, and stiffness. D, absorption of the calcium. So your bones become strong. Contains vitamin A, important for your immunity. You see, we are talking and we continue. Now, Kish Kish, that is why that cod liver oil helped you. So now you know. Hmm? So we have continued. We were at the risk factors of infectious arthritis. Those people that can be at risk of getting trauma with penetrating injury. You see, when you have a penetrating injury, it takes pathogens to your inner lining, and those pathogens can end up going to your synovial joints. Intravenous drug use. When you are using injections that are not sterile, injections that have some pathogens and they bring it to your body. Immunosuppression like HIV, diabetes, and corticosteroids. You see, when you take drugs like prednisolone, hydrocortisone, dexamethasone, these ones are drugs that reduce your immunity to fight. So that if you have an autoimmune infection, they reduce the autoimmunity. So that is reducing your immunity. So if there is a pathogen that has come in your system, what happens? It takes over. You start doing what? Having the problem and feeling it. And then recent joint surgery and injections. Yes. Now, what happens when you inject yourself or something has gone into your system and then you start feeling signs of arthritis? What is the pathophysiology? What happens? What comes out so that you start feeling you have arthritis? Microorganism enters the joint via these methods: hematogenous spread by blood. They have gone to the blood system and they've spread. The second one is direct inoculation, surgery, injection, and trauma. We are doing surgery and some bacteria are finding their way in your body. Eh? Direct inoculation, contagious spread from adjacent infection. You just go to a person who has TB and you start talking to that person and you don't have a mask. My friend, you will get TB born. Hmm? If you have ever find someone who is having TB spike, yes, vitamin A and vitamin D, and there is omega 3 kish kish. You look well and you'll see. But I've told you the importance. Vitamin A is for immunity, vitamin D is for bone. Because it helps calcium to be transported, and then omega 3 reduces inflammation. You see, that's why that thing is helping you. Continue using it and advise during small. Now you know you can take one for yourself, help yourself, and you continue. And then we continue in how it is spread. Continuous spread from a advanced infection. Now I was talking about TB. TB cannot is not only TB of the chest. You can get TB of spinal cord. You cannot even walk because the pathogens have gone to your spine. And you see, you are just talking with a friend, well, not knowing this person that I'm talking to is having TB. But instead of it going to your chest, now it has found a way to your spine or your knees, and then you start fighting TB spine or knee. Hmm? Now, the other second one, we were talking about the spread, hematogenous, which is blood, direct inoculation, which is surgery, injection, or trauma, or contagious spread to adjacent infection. And then we have synovium has rich blood but no basement membrane, easy bacteria entry. Here, there is something called synovium. Here, it has rich blood, but it is not covered by basement membrane, which can protect this from bacteria getting in. So when bacteria go there, they just get in. You see, and then they start eating in the synovium, causing arthritis. And then inflammatory response release proteolytic enzyme and cytokine. So when you get inflammation, they release, because this is a bacteria or a virus or something. They release. Well, when you eat, you go to the loo. A bacteria is a living thing. So when it is eating your synovium, it is going to the loo. So that loo of bacteria or fungus is what proteolytic enzyme. and cytokines, rapidly distracting. So those things that they eat and release, they destroy your cartilages and joint space and narrowing. Hmm? Imagine about that. Imagine, my friends. So you don't. We have talked about arthritis here. So don't ignore some wounds that are chronic. Don't ignore them. That this wound I'm used to it. It will just heal. You are making your body be a home for them, and they will go to your synovium or your bones, and then what will happen? You will have arthritis, my friend. But this is arthritis that can be treated now. Now, we go to clinical features. Acute onset is for hours. Sometimes you find it is hourly, hourly, hourly. We find pain for hours, like 1 to 3 hours, it has gone. And then there is something called monoarthritis. Usually one large joint, hip, knee, or shoulder. You find that a specific place in your body always swells and resolves. Swells and resolves. You'll know that that place has become the temple of bacteria, the place of fight and eat and dying of fungus or a virus. You get it? Severe pain, swelling, warmth, and erythema. Severe pain. Pain, my friend. Pain. Pain is not a good thing, but at least it shows you are alive and your tissues are alive. Because if you don't feel pain, it means those tissues that you are having are dead. So maybe pain is a good thing, but pain is not a good thing, my friend. If you've ever had a pain of arthritis, you know what I mean. But at least it shows that your knees and your synovium or your knee is not dead. That's why you're feeling pain. But you see, the other thing is it can give you restriction of joint movement, stiffness, hmm, fever, chills, and malaise. In gonococcal arthritis, migratory polyarthritis, tenosol, and skin rash. So when you get gonorrhea, for those maybe one have ever got gonorrhea, if you don't treat it for some time, you will get polyarthritis. Several limbs and several places where the bones are lining will start having pain. Tendinovitis. You see, polyarthritis is everywhere. And this one is associated even with skin rash. You see, skin rash. Sometimes skin rashes that are coming when your joints are in pain, don't ignore them. Eh? But there is a word that I wanted everyone to understand. I'll say it. Tenosovitis. The inflammation of synovial sheath, in the sheath that you start having the inflammation. You get it? This is in gonorrhea. People that have got gonorrhea, let's protect ourselves not to get that thing. Now, when you go to the hospital, they'll tell you let's do erythrocyte sedimentation rate, CCPR, to see if the inflammation is high, white blood count to see how you are going. Hmm? People, let's ask questions. Let's just listen. Come again to my channel. Let's listen about and say it's a testimony. People are telling me how they are, and I'm feeling it is good. Hmm? Synovial fluid analysis. You see, they take the synovial fluid here. A syringe is stuck here, injected here, and they withdraw the fluid. It is taken to the laboratory to see if you really have bacteria or fungus, to prove that this is not rheumatic arthritis. Because you go to a hospital, they have done rheumatic arthritis, it is negative. You are having signs of arthritis. They do all the tests, it's okay. We have to get that fluid and see if there is a pathogen. So if we find a pathogen I've said is a bacteria, virus, or fungus, what do? We know that this is infectious arthritis. And you will find sometimes when that fluid is removed from your knee, It is purulent. Purulent meaning it looks like pus because the bacteria are there and they are eating. It looks like pus. And then imaging, you do an X-ray, maybe normal or show joint. Sorry guys. Tough day it is, but I have to do what I have. I have to pass information. Now we go to white blood cells. You'll find they are elevated. Hmm? And at times when bacteria are in your body, you will find you having low glucose levels. Hmm? You see, there are some things called culture and sensitivity. You will find positive glial cells and culture, gram stains and culture. Imaging, early maybe normal or show joint stiffness. And management, this is where we do treat before culture results if suspicion is high. Emergency, you give antibiotics, IV vancomycin, broad spectrum like you give ceftriaxone, cephalosporins, all those antibiotics, your doctor will know which one to give. You see, now we are in arthritis and we are talking about antibiotics. Hmm? It's very important. You drain that fluid because it's passed like now, so that you continue being given antibiotics. Arthroscopic washout. You wash that synovial place to be clean. Mm. And then you give some drugs to relieve the pain. 2 to 4 weeks of antibiotics is very important so that the bacteria cannot go to destroy your 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 bones. And then we have complications. We this has can come with a complication. The complication can be reversible cartilage destruction. You did not treat it in time, and the cartilage has been eaten and eaten. So when it is eaten and eaten, what happens? The bone destroys. It cannot go back to normal. Mm. The bone ankylosis. The bone, like you see this, there is a complication that is called joint ankylosis. This bone, when this cushion is gone, this bone fuses with this and it becomes stiff. Walking becomes a problem. You have to pull your leg up, pull instead of it bending at the knee. Osteomyelitis, infection of the bone. I will talk about osteomyelitis tomorrow on osteoarthritis. Myelitis means the bone has a pathogen, it is being eaten. And then septicemia, now that is the worst. The bacteria that is eating your bone, bringing things like arthritis, they go in all of your body. Septicemia. See, now there was a question by Khalid MTN if arthritis can be treated. The first question by him was, do this type of arthritis affect the knee? Yes, they affect the knee. So a type of arthritis that is called infection, infectious arthritis, it can be treated. If it is early treated, you will be back to normal without any sign of arthritis because you are not arthritis genetic positive. You get it? And then Aristopath asked, said, older folks told me arthritis cannot be cured. Is it true? Now you know there is a form of arthritis that you can cure because it's pathologic. You get it? We continue. Continue with him. If any question, because today this is 6:38. Today I'll deal with the two forms of arthritis. We will be left with some other form of arthritis. We have psoriatic arthritis and gout arthritis, plus the others. We will introduce even lupus tomorrow. So if there is any question today, we have learned about the rheumatic arthritis. and infectious arthritis. If there is any question that a person feels I've left out, please come out and let's deal with it. I'm waiting. I have how many minutes? I have 6 minutes to go. 6 minutes to go. If anyone is thinking of any question that I should address, or how anything that I can manage, please bring it out before I sign out. Hmm? Or even appraisal, something good that we can share, not even diseases. We are used to diseases until any time a person looks at a doctor, he looks at a doctor and sees diseases. There are some friends of mine that when I meet them, let me say in a hypermarket or a shopping, the first thing they tell me is, doctor, I'm okay. Doc, I'm okay. I'm okay. Just imagine. Yeah. But it's good to tell doc, hey, people think doctors don't get sick. I'm waiting for your message, your questions as I give you stories. People think doctors don't get sick. Doctors get sick, but doctors get into depression. You saw the kind of depression and mental issues that the secondary uh, issue issues that professionals get. Mm? They get sick and they are worse because now treating yourself is a big story. Eh? So if you have any question, please bring it on the platform. I'm waiting. I'm waiting. I have 4 minutes. I have 4 minutes to go. I cannot deal with the other arthritis today because of time. I'm seeing my time is going 4 minutes to go. Anyone with any question in the platform? Today it has been a successful day. But remember, after I finish all these topics of arthritis, there is another major one that is coming that we will talk about arthritis in relation to mental health. And when I'm closing the mental health discussion, there is a very important topic that will come that is called palliative management. After that, we will be having people that are real models that have undergone these diseases that I've talked about, that are ready to talk openly and discuss their journey here. That is how we will go about. Oh, Kali MTN. Hope you have my email. Let me post it before I go. Benja. Let me post it before I go. 3 minutes to go. So please, people, it's important to share information, because uh, all I usually say is information is important. It's key to society, and some people suffer because of lack of information. So people, as I close today, I say I have 2 minutes. What I will say is the key management of rheumatoid arthritis. One is reduce the inflammation by getting some drugs like NSAIDs, diclofenac, and do supplements like Kish Kish is doing. Do supplements like the cod liver, which has vitamin D3, and you've seen the work of vitamin D3. It reduces inflammation and swellings at times, and then vitamin A for immunity, and omega 3 for inflammation. Sorry, omega 3 for inflammation, vitamin A for immunity, and the other one, which is D3, which is good for absorption of calcium ions in your body to make your your bones strong. That is the main treatment of the first type of arthritis that we've talked about, which is rheumatoid arthritis. The second one, which is infectious arthritis, and it comes with pathogens like bacteria, fungus, and virus. You should do a culture for the synovial fluid to determine, is it a bacteria? If it is a bacteria, you should do what? Antibiotics. If it is a virus, you do antivirals. If it is an antifungal, you do, if it's a fungus, you do antifungals. That one is treatable. If it is early taken care of before destruction of the bones, you will walk again and you'll be okay. You get it? So that one entails the pathogen cause plus the treatment, a bacteria antibiotic, but you remember you still have to put in inflammatory relievers like the ones for rheumatoid arthritis. The good thing is this one can be treated. The other one you can manage with what we have said. So we we have talked about it, and the questions have come in. I think it's good to stop there. We continue with this tomorrow. Okay, okay. So, it's good to stop there because if you start the other topic right now, it will end up so late. So be blessed, everyone, wherever you are. We thank God for everything. Always, I usually say, love is my religion. I love everyone, I don't hate. And everyone that is in the platform, share these videos, please. Share to someone. Tell someone that if you listen to this, maybe it can be of help. You may be helping someone indirectly and you are not knowing just by listening to me or by sharing and helping. Information is paramount. You get it? So you have a good day and be blessed. Let's meet tomorrow as we continue with other forms. At least some questions have been answered by everyone. Be blessed again. Let's meet tomorrow. Goodbye.